sick of all these lies. Don't care if I capsize. Oh no.
Empty hearts and neon lights, they're playing with my mind. Gotta get out of here tonight. Oh, I wanna run off and fly. And I'll tell myself it's fine to be alone, just to find somewhere that finally feels like home. Oh, oh, oh. I hate all this overthinking. Oh, 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 oh. The more I swim, the more I'm sinking. Take me to a world of silver. No more heartbreaks, tears, painkillers. Take me somewhere unfamiliar. Bring me back to where we started out. Get me out of now. To where we started out. Get me out of now. To where we started out. La 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 la, oh, oh. Get me out of broken hearts and starting fights, turning truth to lies. Gotta get up, stop wasting time. Yeah, I wanna run off and fly. And I'll tell myself it's fine to be alone, just to find somewhere that finally feels like home. Oh, oh, oh. I hate all this overthinking. Oh, 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 oh. The more I swim, the more I'm sinking. Take me to a world of silver. No more heartbreaks, tears, pain.
Hi, good evening, everyone. We're about to begin. I think you want to see my face. Good evening, everyone. We're about to begin here momentarily. I hope you're hearing me clearly. If you are, I'm going to ask that you just indicate in the chat that you're hearing me fine. If at any point we lose audio, I'm going to also ask that you indicate it in the chat so that I can see that something has gone wrong. All right. So we're about to begin. I actually seriously contemplated whether I was going to have this class or not because obviously it's Holy Thursday and normally the office would have been closed. Well, it is closed, but I figured that rather than locking away because nobody's able to interact with anybody again these days, especially in Jamaica where we are currently under a lockdown, a complete curfew until next week Tuesday, and we can't move. I figure I'd give an opportunity for you all to be able to just hear somebody's voice, talk to somebody. So I hope that works well for you. Let me just answer over Liner. All right. So let me try to bring up our information here. Where are you? Ah, there you are. Okay. So let us begin, shall we? It's now 6:20. I think it's ample time now. I think a lot of persons um, who are planning on joining us would have done so by now. So, Ivoline, yeah, now that's a name I know. Welcome, Ivoline. Welcome. Let me bring up your thing here. Welcome. So let us begin. Tonight we're going to be talking about, it's another patient health workshop, and each of these workshops, we basically handle the same topic. They tend to have slightly different spins, but we tend to handle the same topic. The topic is um, 7 keys to getting and staying well. 7 keys to getting and staying well. So that's what we're going to talk about, and hopefully you find it interesting, at least interesting enough. And if you have any questions, I want you to also feel free to raise them, share them with me, share them with everyone who's listening, and hopefully other persons will find us as well. If you have friends or family members or anyone that you would like to, you know, hear what we're going to be talking about or to, listen to another perspective on health, I welcome you to give them a call, give them a shout out, send them a WhatsApp or some other messaging app and let them know that we're on. And all they do is just to go to YouTube, type in Gardner Chiropractic. That's Gardner, Chiropractic, Chiropractic. And they should be able to join us here. Now, as we begin, I'm going to just remind everyone to please subscribe to our channel. If you haven't already done so, hit the subscribe button and give us a thumbs up if you'd like. And I think it means something. I think I get points or something. And more people will have a chance of finding us, that's for sure. And click also on the little bell icon beside the subscribe button, or after you click subscribe, you'll see the little bell icon come up. Click it so that we can notify, or you can be notified whenever we go live. As I indicated before, mark on your calendars, please. April 29th, we'll be doing our movie with the doc, where I'm sharing different films, and we're doing this every fifth Thursday of a month. So any month that has 5 Thursdays in it, that fifth Thursday we'll be having the movie with the doc, where I'll be showcasing an interesting or powerful film or documentary that I think is relevant to health, and then we get a chance to discuss it. The one that we're going to be discussing coming up here is a very powerful one that talks about vaccinations. And with all that's happening, I think it's important that we delve a little bit into it and give you all a chance to ask questions and interact, because as it is so far, most persons, we are living in a fear-shaped world as it pertains to the current situation with this pandemic that we're told is happening. And I'd love to be able to provide some alternative viewpoints, so that you're not just hearing one side of the story, and if you get to hear both sides, then you can make up your minds, I think, better. Sometimes people believe that if their position is correct, that the persons who they're trying to influence should never be exposed to a contrary position, because they are afraid that the person might select some different option. But in my opinion, I believe firmly that if you get a contrasting position different from the position that you hold, even if you still stick with your original position, your conviction will be stronger. Your appreciation of your viewpoint will be stronger, because you were exposed to a contrasting viewpoint. And I think it's important, and something this has been lost recently with the whole handling of this pandemic, because any voice that's considered a dissenting voice is silenced. And even as I mentioned this to you, I have to be careful how I position and phrase or frame what I say, because there's a real risk that YouTube or Facebook or whatever social media or Google will try to shut us down if we say something that's overtly contradictory to the mainstream narrative, even though what we will share is backed by science. They're not interested in science. The only thing that's interesting to the powers that be is that you follow the narrative. You follow what they tell you to do. You run out and go and get your vaccine, because you're going to be protecting yourselves and your loved ones by taking a jab in the name of good health with something that, one, has not been used in humans before, in the case of the Moderna and Pfizer vaccines. Two, that have limited safety studies in the case of every single vaccine that is currently pre-approved for use um, or emergency use authorization, which means that they're not really approved. They're just allowed to be used because it's an emergency situation. And there are many people who are hoping and trusting that it is safe, and so they take it. But bear in mind, if it is already proven safe and proven to be effective, then it would have already been approved by the governing bodies, and it has not yet been approved because it has not yet been proven safe, or none of them have been proven safe or effective. So those studies are still underway. If you run to get it, it's your call, but just realize that you're doing something, hoping that it doesn't harm you when there is absolutely no evidence to suggest that it won't harm you. So, yeah, it is what it is. But tonight, that's not our topic. Tonight, our topic is the 7 keys to getting and staying well. And so, as we go through these things here, if you have questions, please feel free to let me know, because it is in answering these questions that we will have the best opportunity to participate with each other, learn from each other, grow together, and hopefully come to an understanding that helps to enrich our lives in total. All right, so that's what I'm hoping for. So let us begin, shall we? So the topic, as we said, 7 keys to getting and staying well. The first of which is understanding the difference between sick care and healthcare. When we talk about the current healthcare system, I think it's important that people understand now that this system is not a system that is geared at getting sick people well. That's not the focus of this system. I know there are people who will probably, want to disagree, and it's your right to disagree. But hear me out before you do so. As indicated by, I believe it is the what's it called? It's the name of the governing body in the U.S. The Jamaican one is in my head. But it's the governing body for the medical association. Trying to remember what it's called. If you remember, put in the chat for me, because I'm drawing a blank. I don't know why. But according to them, there are 2 primary goals of the healthcare system. One is to save lives. One is to save lives. And the other is to ease suffering, AMA. Lord have mercy. Thank you very much, Delroy. It's the American Medical Association, the AMA. To save lives and ease suffering. Those are the 2 goals of the healthcare system. And so when you understand that those are the goals, then you understand why it is that some of the decisions that are made. For example, somebody with cancer might be given a very poisonous drug to take, that if they take it for long enough, it may very well kill them, or they will expose them to very dangerous levels of radiation, which is totally not healthy. But in an attempt to save the person's life, they are doing an intervention that is not necessarily healthy, not necessarily going to bring them to a better place of health, but in an attempt to attack the disease. So everybody gets attacked, but the hope is that the disease will die out and the person will survive the treatment, so that after treatment is stopped, they have a better chance of now recovering. If the goal is optimizing health or making sick persons well, not simply fighting disease, but making a sick person well, then the approach is likely to be different. And this is something that I hope people can kind of wrap their minds around, because the belief that the healthcare system as it exists today is focused on trying to get you healthy is what is frustrating people and causing people to make poor choices. They will go to their family doctors wanting nutritional advice. Doc, I hear that this supplement is good. I want to take it. What do you think? The answer that invariably comes back is there's very little evidence to support its use, and so I would not recommend that you take it or that you do it. This is the standard response that you get whenever you speak to the regular physician about anything to do with a natural approach to health. And it's unfortunate. It is really unfortunate. But their position is largely because of the limitations in their studies. And I don't say this as an insult, it is just pointing out how the curriculum or the curricula are set up as it pertains to med schools. Because most people are not aware that the medical programs do not do much in the way of nutritional education. They know very little about nutrition. They certainly know even less about natural remedies or natural supplements that can be used to combat illness. And it makes sense that they would not be taught this, because it is the pharmaceutical industry that shapes the whole practice of medicine, because it is the pharmaceutical products that are the primary deliverables that are recommended by your physicians, separate and apart from surgeries, but surgeries is its own thing. So we need to kind of have that understanding right away. So there are limitations, and because of these limitations, the focus of the healthcare system is not on getting wellness or achieving wellness, it is preventing sickness. And those are two very different things, and I hope you understand what I mean when I say these are very different things. Preventing sickness is not the same thing as achieving or ensuring wellness. You see, you have a health continuum, and I'm going to just kind of use this continuum here, where at the bottom end is death and at the top end is optimal health and vitality. If you are somewhere on this continuum, you're always moving in one direction or the other. You're never stationary. So you're either moving up toward optimal health or you're moving down toward the disease and death. A movement upward towards optimal health is called wellness. That's what wellness is, moving toward optimal health and well-being. That is wellness. Whereas moving toward death and disease is called illness. So if you are moving toward death and disease, you are moving in a direction of illness, or you are in a state of illness when you're closer to death and disease than you are to optimal health. If you're moving toward wellness or in the direction of wellness, you are moving toward optimal health, and the closer you are to optimal health is the closer you are to achieving wellness. So much so that if you are closer to optimal health than you are to disease and death, then you are considered to be in a state of wellness. So wellness is both the direction of travel and the position on the scale that you are in, and illness is the same, right? They're just pointing in opposite directions. So if you're trying to prevent death, you are operating on the low end of the spectrum. If you're trying to achieve optimal health, you are operating on the upper end of the spectrum. And you know what? if you want to achieve the best in life, the best quality that life has to offer, what place do you suggest or do you think would work out best for us to stay? Closer to death or closer to optimal health? I think the answer is clear, right? I think the answer is clear. So let's continue, shall we? So sick care is reactive. Sick care is reactive. That's the first limitation or downside toward this whole model, is that we're cultured in that sick care model, and that sick care requires something to have gone wrong first. And because it's reactive, we are limited in how well we can handle the person's state of affairs. Now, the difference between sick care and healthcare is that true healthcare is proactive. What do we mean by proactive? Who can suggest to us what is meant by proactive? What do we mean by proactive? Let me just give you all a second to respond. And while we're waiting for the responses to come in, what do you mean by proactive? I'll just make a comment on a couple things that I'm seeing here in the chat, where the AMA, as it's purported, was designed by John D. Rockefeller. It's kind of partly true, maybe not in its entirety, but the whole healthcare system, the whole medical system as it exists today, is largely due to the Rockefellers and what is called the Flexner report. Flexner, I think it's Flexner. It's either NER or NOR. You can look it up. But that Flexner report is a report that was done in the turn of the 20th century, at the beginning of the 20th century, when they totally revolutionized the healthcare sector. And it was an interesting time in the world, because at that time, that's when they just started to use fossil fuel for energy a whole lot more, just coming out of the Industrial Revolution in the 1800s. They had the heavy usage of fossil fuels for energy, oil and so on. And it was the big investment at the time. And they wanted to find different ways of using oil-based products in everyday lives. And one of the ways that they came up with was in the development of drugs. You heard me right. Drugs that are synthetic, that can utilize these oil-based products for people to ingest. And yes, petroleum to be specific. And this is, it is really sad, because we've seen humanity being really destroyed because of greed. And anyone who says there is no evidence that greed is taking place and destroying our humanity, just take a look at the rate of disease in our world today and compare it to the types of diseases that occurred. Certainly, I would say in the early 1800s, late 1700s, more so than even the early 1900s, because a lot of crazy things started happening in the early 1900s. But that's a talk for another day. So, proactive means that we are acting before something has gone wrong. And it's important for us to be able to do so, because if we fail to act before something goes wrong, the thing that goes wrong might be something that impacts our health permanently. What if we get a terminal illness that we know is going to kill us? We can't simply wait until that time before we act. And by the way, cancer typically is not a terminal illness. It is an illness that can have a terminal prognosis if it's not handled properly. And I want to show you in one of my movies and movies with the doc talks or shows how cancer does not have to be a thing that kills people. But people will continue to die because they're doing wrong things to treat their cancer. And by the way, if you have anyone dying with cancer and you're tired of the approaches that's currently being done, or they don't seem to be responding favorably to the approaches that are being taken right now in mainstream, give us a link. Just drop me your email address in the chat, or we will put an email address in the chat towards the end, and feel free to shoot us an email. All right, I prefer you do it that way. Wait for us to send that email in the chat, and you just shoot us an email. But lifestyle diseases is the number one killers in the world. It's certainly the number one killer in Jamaica. And whether it is heart disease, diabetes, stroke, hypertension, and the list goes on, these are all lifestyle diseases, which, as the name suggests, is as a result of the lifestyle that we have, either by activity level or by things that we're putting into our bodies. Diseases are caused by two things and two things only. Every single disease that we experience as humankind come from one of two causes. Either you are exposing your bodies to something that you should not be exposing it to, or too much of something than you should be having in your system. That's what you call a toxicity. You're exposed to either something you should not be exposed to, or too much of something that you're commonly exposed to. This is called toxicity. Because good things can become toxic too, if you're exposed to too much of it. Or poisons in our bodies are toxic at almost any level. So that's the first thing. And the second thing is not taking enough of something that your body needs. So we're talking about a deficiency. Either you have a deficiency that's leading you to disease because of something you're lacking, or toxicity, which is leading to disease because of something that you're ingesting. All diseases fall under one of those two categories as the cause. If you know of some other cause, please let me know. I'd be curious to know. Now, the way that we think is what leads us to having disease in our systems. Because we're making bad choices. We're making bad choices for our health, and we're getting ourselves sick because of these choices. So we have to learn to change the way we think. Otherwise, we will continue to break down and continue to make bad choices. So what are these ways that we think? We think according to two models, and one model is taught to us by the pharmaceutical industry. I bet you can guess which model that is. And the other model is what I'm going to suggest to you tonight. So the first model is illness care. And according to the illness care model, we are taught by Big Pharma. If you look at any drug ads, they will tell you, if you have something wrong with you, talk to your doctor about what you can take in order to feel better, look better, have clearer skin. Not necessarily in order for you to get better, but for you to feel better. And that goal of feeling better is where the danger is, because there are many things that people can do to temporarily allow your bodies to appear to be doing better, even though it is not. I'll ask this question because I'm dumbfounded every time I hear whether it's a patient or a physician, answer this question. So I want to hear how you would answer it. If someone has high blood pressure and that's the only thing that's wrong with them, let's say their blood pressure is 160 over 110, which is a pretty common range for blood pressure that's high. So that person is hypertensive. If I could give them a drug, I won't call the name of a drug, but a hypertensive medication that brings their blood pressure down to 120 over 80 or 115 over 75 or whatever is considered to be normal these days, is that person now healthy? Remember, high blood pressure is the only problem that they had. You give them a hypertensive medication and their blood pressure now goes to normal. Is that person now healthy? Curious to know how you would answer that one. So I'm waiting for responses in case you didn't know, right? So type in your response. I want to kind of see what you are going to say. As we give you some more time here. Just waiting for you to come in with a. Okay, let's see there. We're getting it. So very good. I'm seeing some great answers coming out. Deloy says they're healthy only if they remain within the readings without medication, and that's very important. If they maintain their normal status without medication. And Tamara says no, because the reason is not known. In other words, they are not healthy because the reason is not known. And those are very important answers. And yes, I would agree with those answers, because let me tell you a simple fact that is not known by most people. It is impossible to be healthy if you're on medication. It is impossible to be healthy if you're on medication. Partly because medications are poisons, they are toxins. Every medication is a poison. There's no medication or no pharmaceutical that's not poisonous. They're either processed by the liver or the kidneys and are eliminated from the body, and in the process either causes some damage to the body or will cause something to go out of whack. Pharmaceuticals are toxins. The good thing, though, is that some of them, the toxic burden is so low that it is considered reasonably safe. And that term, reasonable safety, is an important term, and it has a very specific medical meaning. It means that within a certain limit, it is considered safe. It is not absolutely safe, but within a certain limit, it's considered safe. So it's reasonably safe. But as it relates to feeling better, I want to just move forward to what the wellness model thinks, or what the wellness thinking should be, and that is, if you have something going wrong, instead of asking, what do I need to do in order to feel better, you need to ask, what do I need to do in order to get better? Because you want to get better, you want to achieve wellness, you want to achieve a better state, not just feeling like you're doing better, but having a better state. If you're having a headache, You don't want to just take a painkiller to block the pain. You want to do something to find out what's causing the pain so that you can alleviate the cause of the pain so that the pain goes away. That's the only way to achieve good health, is to eliminate the cause of disease so that health can be restored. In fact, that's the only way that the body achieves good health. Removing something that's preventing health from being achieved so that the body will now naturally, on its own accord, by the law of healing, get better. That's it. It's simple. Getting well is another way that the illness model tries to trick people into thinking. And I apologize for using a derogatory expression to say trick people into thinking, but it is somewhat misleading. And if it's a deliberate attempt to mislead, then it's a trick. So it is misleading for people to have the notion that wellness is something that they can just achieve. When you go to the hospital and somebody is sick and you give them a card and the card says get well soon, what you're in essence saying is that you're hoping that they will fall into wellness, that they will miraculously achieve that state of well-being. But the reality is that wellness is not about a destination. Wellness is about a journey. You're on a journey of wellness, and it is a continuous path. And so when we talk about the wellness thinking that's different, it's not about getting well, it's about staying well. It's staying on that wellness journey. Because the moment you stop doing the things necessary to achieve this state of wellness that people are hoping to be able to achieve, what ends up happening is you end up being frustrated by the process and not getting there. So if somebody, for example, I don't know if you've ever traveled a long distance before. I remembered once, several times my wife and I, we go out of town. And as we go out of town, we may go on a 2-3 hour drive, right? If we're going to Montego Bay, for example, it's about 2.5 to 3 hours from Kingston, depending on where you're going and where you are, where you're coming from. And if my goal in that journey is the destination, let's say I'm going to a resort, and it's only about getting to that resort. Maybe I heard that they have the best food or whatever, the best vegetarian cuisine, whatever. And so I'm on my way there, and I'm thinking about the destination. I will be frustrated about not being there, and I will be counting every mile, and I'll be longing to arrive. This is kind of what happens to people who try to go on a weight loss program to lose weight, where their goal is weight loss. Their goal is not to live a healthy lifestyle. Their goal is simply weight loss. And because the goal is weight loss, they are so focused on the destination that the destination frustrates them on the process. And so they find the process almost unbearable to manage. If instead your goal is to stay well, which means that you have to do something ongoingly to maintain that state, it shifts your focus from the destination now to an ongoing process, which is the journey. And if the journey is what is important to you, then you will find pleasure in the journey itself. You will find fulfillment in the journey itself, and you will find that achieving or growing or getting closer to your destination is not as difficult to do. And so I also remember going on long trips with my wife where we just said, you know what, we're just going to go on a drive, enjoy the countryside, enjoy Jamaica. And, we're going to overnight somewhere, but it's not about where we're going. It's about driving through Holland Bamboo and going through Santa Cruz and what have you, and just enjoying the Jamaican countryside and the scenery. And what I find happening in that instance is that if an hour passes by, we don't really notice. If 2 hours pass by, we don't notice. Because the time is moving so slowly because we're enjoying the process. And so my encouragement to anyone who their desire is to lose weight is to shift your focus away from simply saying you want to lose weight to shifting it to saying, I want to live healthy. Because if a healthy lifestyle is your goal, then there are many things that you can do to live a healthy lifestyle. And it so happens that the things that you will do to live a healthy lifestyle are the things that you will need to do to lose weight. So you will achieve your underlying desire without making it your overarching goal. And that is the trick or the key to a wellness lifestyle. Achieving your underlying objective or underlying desire without making it your overarching goal is the way to success in the wellness paradigm. How about this one, staying alive? Now, there are many people who try to convince persons that how long people live is the real beauty about how well the healthcare system is doing. How long people live is a trick. And again, I apologize for the derogatory expression of trickery. But when you look at life expectancy as an example, and you will see life expectancy being one of the reasons why the healthcare system is considered to be superior, saying that people are living longer. Yes, it is possible that life expectancy means that people are living longer, but it does not necessarily mean that because the average life expectancy has moved from 70 in 1960 up to 81.5 in 1990 or 2000. That is the situation that we find ourselves in. I'm hoping this doesn't cut us off. Good. That is the situation that we find ourselves in, is that the mindset that persons have. I got distracted. I had an incoming call. I apologize. And I got a little bit distracted by the call. But I'm going to get by my train here in a short while. Yes, life expectancy. So this is how it works. Life expectancy, the numbers. Let us say we have 10 people. 5 people die at 2 years of age, and 5 people live to be, let's say, 82 years of age. The average life expectancy is now 80 years old. You average everybody, divide them by the total, is 80 years old, right? No, I might be making a big mistake here. It's 2 plus 82 divided by 2, right? Which is 84 divided by 2 is 42 years old. So the average life expectancy is 42 years. Now, because the average life expectancy is 42 years, what ends up now happening is if you move somebody who lived to be 82 and say they now live to be 92, all 5 people now live to be 92 years old, then what does this mean? Well, 92 plus 2 is 94 divided by 2. You've now moved the life expectancy from 42 to 47. So it went up by 5, right? That's not a whole lot. But 10 years were added to the old people's lives, which, we're saying, boy, old people are living much longer. To live from 82, dying at 82 to dying at 92 is a lot longer. But the life expectancy didn't change very much. Here's what happens. If instead you ensured that children didn't die, and you saved the lives of those children that would have died at 2 years old, and instead they're now living to become an adult, even if they live to be 20 or 30 before they die, we're talking about adding decades to the life expectancy. And so, to the overall numbers. So the average life expectancy now will be considerably higher. So when you look at life expectancy numbers and you see the numbers going up, it reflects more on how well the system is doing to keep children alive than it is on how long people are living. So we need to get that straight so we can understand, so we're not misguided, right? All right, so staying alive cannot be the goal. The goal is feeling alive. We want people to have a wellness lifestyle, to feel that quality of life that says, I am feeling great. I'm living to achieving this wonderful life expectancy, and I am feeling tremendous in the process, right? That is really the key, I think, the key to this all. So here we go. As we move forward, let us look at the next paradigm, right? Pain is not simply just something that hurts. Pain is a very interesting entity, and I want persons to understand and appreciate how pain works. So let's move forward quickly because I don't want the time to drag out very much longer. So let's see how pain works. There are many people who would say pain is a good thing. Some people say pain is a bad thing. Irrespective of what your position is on pain, it's important to recognize that pain has a purpose. Pain has a purpose. And that purpose is that pain alerts us that something has changed and requires our attention. That's what pain is. Pain alerts us that something has changed and requires our attention. Now, whether pain is good or bad, it is really risky to live our lives based on the presence or absence of pain. Because if we're feeling pain and that is our motivation to go to the doctor, then what happens when we're not feeling pain? We won't feel the need or the desire to go to the doctor anymore. So not feeling pain is not necessarily a good thing, right? It doesn't necessarily mean you're doing well. In fact, the problem with pain is that you can't trust pain to tell you when something has gone wrong. So having good health doesn't mean that, or feeling good is not the same thing as having good health, right? If you want to know if your health is good, you have to check how your body is functioning. And the best way is to check the function of your body is by looking at the different systems of the body. So we need to learn to stop trusting the way our bodies feel and trusting more how the body works. Because remember, you can have cancer and not be feeling any pain until the very late stages, and sometimes never feeling pain. Because not all cancers are pain causing. So this is important, right? This is important. So when we look at the body now, there are different systems of the body. And the systems of the body and that's an important point. So when we look at the systems of the body, when we look at the systems of the body, the all the other systems, and that system is the nervous system, and because of that, it is oh, let me see. Let me see if we are back. Hold on. Still no audio? Oh, good now. All right, so maybe there's something that goes wrong when I switch to that closer view. All right, so I'm going to do something here that should work. So bear with me here. Good. Okay, I know why it's not working, but I tried to solve it and I could not at the time. Don't know why, but it is what it is. I'm gonna just try to plug along without the screen, the big screen, right? But as we go through, and I hope you can now see this um, and hear me, as we go through, the nervous system is considered to be the master control system of the body. Nervous system is the master control system of the body. Whoa, something is going awry here. Oh, I might have lost my video. So, 1 minute. All right, everyone, just bear with me. Bear with me just for a little while. I'm going to try to bring this up. All right. Bear with me, guys. Bear with me, please. I apologize for the interruption. All right. Bear with me here. All right. And here. Please, I apologize for the break in transmission. I'm just gonna get things back up and running here in a short second. So just bear with me here. All right. So, are you hearing now? I hope you are hearing me well now. I'm just going to double check because I've changed something here. Making sure I'm not getting any double sounds. Yes, we're sounding, I think we're good. Good, excellent. All right, so let's move again, right? Now, of all the systems of the body, the one system that is considered to be the master control system of the body is the nervous system. And it's the nervous system that's the master control system, not because it's the most important system necessarily, but because that system is what controls and regulates all the other systems. Our brain and spinal cord are controlled or are the vessels that are used to control the other systems of the body. And so if we, and I'm going to try to go back to the full screen here. I think we should be good now. To do the zoomed in view. This system has the brain and spinal cord, that are the primary organs of this system. And if you look carefully, you will see from the brain and spinal cord, you have some blue lines and some yellow lines that go to each of the organs. If you look at the heart here, you will see the heart has a blue line and a yellow line. Every organ has lines that go to it. One line serves as the accelerator, it speeds up that organ, and the other one serves as the brakes, slows it down. So when we look at all the organ systems, whether it's our respiratory system or cardiovascular system, they're all under some control of the nervous system. And it's because they are under the control of the nervous system why we say the nervous system is a master control system. Now, as the master control system, what we see is that the nerves, they have to travel between the bones of the spine in order to get to the organs. And if the bones of the spine are out of alignment, then it may impact negatively, certainly, the function of the nerves that exit. Now, there are different ways that this misalignment can impact the function of the nerves. One way is by causing direct compression on the nerves by the bone, which is probably the hardest way. Usually that requires a considerable amount of dislocation of the vertebra in order to achieve. Or pretty profound degenerative changes within the joints of the spine or the bones themselves to cause compression directly on a nerve by the bone. The other way that is important pardon me here, there's someone that just keeps calling my number, and I apologize for the interruption, but they keep calling. So I'm wondering if it's an emergency. And no, it's not an emergency from one person. So I'll go ahead and call them back afterwards. So I'm going to put my phone on flight mode. All right. All right, so sorry about that, everyone. Golly, just had to try to get things kind of sorted out here. All right. But as we move forward, the nervous system is a master control system. Now, if a bone is out of place, then it can cause direct compression of the nerve, but it can also cause the cartilage between the bones to slip out. We call that cartilage the disc. And the disc is one of the most common things that will actually cause compression of a nerve. And so we're going to talk about that in a second. So the technical term for spinal misalignment is a vertebral subluxation. That's the technical term for spinal misalignment. And they cause nervous system dysfunction. And this is what it may look like. If you look at the third bone in, the middle bone, that bone is displaced inward. The opening, which is where the nerves exit, the yellow thing here is a nerve, the red thing here is a nerve. This yellow one is also a nerve. If you shift the bone out of place, it closes off the nerve and may cause compression there, impacting the function of that nerve. Also, the cartilage between the bones may slip or shift. This is what we call a slip disc. And this slip disc is something that can also compress the nerve and cause irritation, impacting the function of the nerves. If the nerves are not working properly, ladies and gentlemen, boys and girls, if the nerves are not working properly, then any one of the systems can be impacted. And so it is possible for you to have a problem with your heart. Let's say rapid heartbeats, irregular heartbeats, if there is an irritation to that nerve that controls the heart or the rate of the heart. If you have compression of the nerve that goes to the airways in the lungs, you may end up with a problem with the airways, which is what we will call like asthma, for example, is a very common one that happens. So if you have a problem, let's say somebody has constipation, it could simply be that the nerve that controls the bowels and the large intestines and the small intestines might not be working properly, causing the muscles to not constrict appropriately and thus causing a difficulty in passing stool. There are many things that can go wrong if your nerves are not working properly. And the thing that causes the nerve to not work properly that we can treat is a vertebral subluxation. Now, there are things that can happen that we cannot treat because they are not necessarily things that are chiropractic in nature. But if it turns out that the problem that's going on with you is something that impacts the spine or is as a result of a misalignment in the spine, then most of the times we can treat that as long as it's not yet at a surgical stage. And so vertebral subluxations cause nervous system dysfunction. I'm going to move fast forward a little bit because we've spent a lot of time delving into a lot of different things, but I just say that stresses in our lives is what lead to dysfunction in our systems. And there are three different types of stresses that we are exposed to. Physical stress, like a fall or an accident, like a car accident. Biochemical stresses, like things that we put into our bodies, some of the foods that we eat, chemicals that we are exposed to. Even vaccines are a biochemical stressor that our body has to cope with. Psychological stresses, and the psychological stresses that we face include the relationships that we have and the quality of those relationships and whether we are stressed out by them. It could be a work relationship, it could be the work job itself, it could be somebody at home, it could be somebody in our lives that is sick and we are worried about them. So physical, biochemical, and psychological. The healthier our nervous system is, the better our ability to adapt to our environmental stresses, and that is important. The healthier our nervous system is, the better we are able to adapt to our environmental stresses. I'm going to just skip through these and point out that yes, we promote chiropractic as a strategy for achieving good health, but chiropractic alone is not going to help you to achieve good health. If you have poor nutrition and you have a stressful life, it doesn't matter how many chiropractic adjustments you get, you're not going to be healthy. So health and wellness is a system that is overarching. It requires multiple different facets of life and function in order to be able to achieve it. So it's multifaceted in its effect, right? At our office, we care about these subluxations in somebody's spine, and we care about how they do, and we care about how it impacts them. And so we've invested in technology that helps us to measure the function of the spine and how it works. There are two types of technology that we use. One is called the rolling thermal scan. The other one is called the surface EMG. The rolling thermal measures skin temperature, and sometimes when there is a misalignment in the spine, it may impact the temperature of the skin in that area. The other one is the surface EMG, which is electromyography, which measures muscle activity in the spine. And if the muscles are not working properly, this is something that we can pick up. And it usually happens as a result of some spinal dysfunction as well. When we look at the effect of the adjustment on the person, what we do realize is that the individual and has to show some effect. if what we do impacts the function of the person's nervous system, then not only should there be an effect, but there should be an effect on the brain that we should be able to measure, because we have many ways of measuring the brain. And so this lady was given a pre and post functional MRI, which means it's an MRI that shows areas of activity as different color lights. She was asked to perform a simple action: wiggle your left ankle. And as she wiggled the left ankle, what we saw on the left hand side was what the brain looks like, and on the right hand side was what it looks like after the adjustment. Before the adjustment, you had lights all over the brain, which means that the brain was not operating very efficiently at all. But on the right hand side, fewer areas of light, which says that something changed in the brain that made it more efficient. And considering that the only thing that happened was that the person got a chiropractic adjustment and shortly after the test was repeated, then we know that it's the adjustment that's likely to be the cause of that change. And this is repeatable, and we see the same thing happening. And so what we do see is that as a result of the adjustment, the person's brain is more efficient. The person's brain is certainly more efficient. Alrighty, so let's move again. Chiropractors are not bone doctors. We are nervous system doctors, because the work that we do impacts the brain and nervous system much more than it does the bone itself. So when somebody comes to us because of a dislocation, it is important to point out that that dislocation is not for me to treat, because that's primarily a bone issue. However, if they have a spinal misalignment that's impacting the function of the nerves, then you want to come to somebody like me. Almost finished now. I'm a chiropractic neurologist, which means that the work that I do is specialized work. A chiropractor is somebody whose education involves realigning the spine, primarily. And the realignment is good, but sometimes there's something going on in the brain that might need our attention as well. And as a chiropractic neurologist, my training, my education involves retraining the brain, where we can re-educate the brain to do what we want it to do to achieve good health. All right, so this is something that's important. These are some examples of conditions that we've treated at the office here with chiropractic, and it seems to work well. Not everything gets better though, you know. Don't get me wrong into thinking that by treating these, I mean everybody gets better. I've seen improvements in every single one of these things, but not everybody who has an issue in any of these things will get better. Some people will not get better. Some people do not get better. All right. So at our office, as we wrap up now, our office is primarily focused on being able to identify subluxations wherever and whenever they happen. That's misalignments within the spine, and try to correct them, to provide a program of care to help people to get better, and to educate our community. These are the ways that we do what we do, and how we do what we do helps. And so the last key is probably the most important one, which is, I am not the one that's responsible for your health and well-being. The key to getting and staying well is for you to take responsibility for your own health and well-being. It is important that you take your health into your own hands and not wait on some doctor to tell you what to do, Start doing things to improve your health. Even if the doctor is me, don't wait on me. Start doing things to improve your health. Looking at, whether it's looking at Google and trying to understand how your body works, and trying to understand what you need to do on an ongoing basis to achieve wellness. Remember, it is the journey that's important, not the destination. We also, on our YouTube channel, have some video testimonials. I invite you to, when we're finished, to look to them and try to see if you can identify with any of these. But there's some good ones. I've not put out any recently because these actually promote a lot of people coming to the office. And unfortunately, we are really oversubscribed, and I'm going to need help sometime very soon to handle the load of persons that I see, because right now we're at about a 4-month waiting list, and that to me is really long, and we want to try to do things about it. So we're hoping to be able to take on some associate doctor to help us, hopefully in the near future. All right, and so somebody who is well trained and able to deliver the kind of services that I'm able to deliver, and probably even better. All right, so this is that. Now we're at the end of our presentation, and now there's a couple of points of import. If you've not yet indicated your name in the chat section, I'm going to invite you to please do so. I'm going to invite you to please do so, because the chat is how we're going to know who participated, who listened in, and who is going to be able to capitalize on the special offers that I'm going to make. Now, these offers are made at the end, and we don't mention it at the beginning because we don't want to use it as a bribe to get anybody to do anything. But by participating, you do get a reward, and hence the difference between a bribe and a reward. So here we go. For anyone who is interested in making an appointment to see us at our office, you've participated and you want to make an appointment to come in and see us, I encourage you to call appointments@gcnjamaica.com. That's appointments@gcnjamaica.com. And it's very important. It's very important. What you do is you make that call, you send that email, and somebody is going to answer. They can also call the office and let them know, but shoot the email out to that person and they will let you know. And it's Karen that is, you see Karen sending a chat here. It's Karen that's going to be the one answering that email. Or you can call the office and let them know that you watched the lecture and that you wanted to take advantage of the 40% discount for that new patient exam. As I said, there's a long waiting list, so don't expect that exam to come across very soon, very quickly. But if it's an emergency, you can ask to be placed on a priority waiting list. Should somebody cancel, you can get that spot. Once you call and say that you've participated in the lecture, we will double check the chat section to see if we see your name. If your name is not listed, then we will assume that you did not actually participate in the lecture. And so please make sure that you do so. All right? You can call our office, and I'll leave the office number as well. Our office number is 876-978-1050. That's our office number. So please call us or email us. All right? For our existing patients, you will get a 20% discount off the new patient exam, the update examination, which is almost the same cost of the new patient exam. So when you get done with a treatment phase of care, and a phase at our office is about 12 sessions, when you get done with the 12 sessions, you will get a 20% discount. Well, you'll sit an examination again where we'll compare the results, and then we'll put you on another phase of care if it turns out that more treatments are needed. And if that's the case, then you will get a 20% discount off that entire next phase of care, which is another 12 sessions. So that dollar figure alone is a lot more money saved than the 40% discount. We also offer referral discounts for those people who will refer friends or families to our office. You will get a discount for referring them of 20% off one treatment per person that you refer. And that person will also get a 20% off their examination fee. So there's an incentive to both you and the person if you were to do that. And the last thing is the phase of care. I may have misspoken, so let me clarify again, right? I misspoke. You will get a 20% discount off your update examination, which is almost the same cost of your new exam. You get 20% discount off one treatment per person that is referred to the office, and that person will also get a 20% discount off an examination when they do come in. So they don't just come in and pay full price, they'll get a 20% discount just because you referred them. And you will also get a phase discount of 10% off the entire next phase, and that phase is 12 treatments plus an examination. So you get 10% off 12 treatments and the exam. So that's what you will get for that. The new patients will get less money than our existing patients in terms of a discount, but I have to offer more to my existing patients because you spent more with us, so we offer more. All right, so it's my hope that this has been a helpful time. If you want to get in touch with us, you can link up with us on our social media, and there are different ways of doing this. We also have a Twitter account. I don't remember the Twitter handle right this moment, but if you type in Gardner Chiropractic and Neurology, it should come up. I think it's Gardner Chiro 1 is for my Twitter. And for Instagram, I think it's Gardner Chiropractic. I'm not 100%, I think so. But certainly, our website is gcnjamaica.com, or you can link us on Facebook at GCN Jamaica. Contact us via YouTube, or look at our channel on YouTube via Gardner Chiropractic. By searching for Gardner Chiropractic in YouTube, it should take you to our channel. Or by searching for Back to Health Talk Show with no spaces, it should take you to our page on Facebook. I'll try to stick around a little bit longer to answer any questions that you may have, but it is with great pleasure that I was able to just spend a little time with you. And it is my hope that your quality of life is certainly better. Your quality of life is better, and the choices that you make will be better once you start living according to the wellness way of thinking. And I believe if you do so, you're going to see transformations happening in your own life and in the lives of your family members and friends. So I'll stick around for about 5 minutes, answer some questions, and play some music so you guys can just relax and enjoy. So it was indeed my pleasure being able to share with you, and I hope that you enjoyed sharing with me all the same.
I know, I really I'm alone, I'm a broken home. I gave you all the bricks that I own and know. I'm letting go, I'm breaking these walls down, breaking these walls down. If you want adventure, then fly to home. But if you wanna travel, then go alone. Yeah, what's the point in us if I never know? Yeah, if you're gonna leave, I'ma let you go. I'm tired of the pain. Go away. I'm tired with this and time. I fell where my demons dwell. My own little nightmare, I call it hell. Oh well, it's time to get back up, climbing and climbing. I'm done with this ride, is what I tell myself, so I could feel something else. Yeah, I guess I had my bad days, but it doesn't mean I lost my style. Where were